Hi, everyone, and welcome to the LGBTQ Consortium. I'm Kim Hunt, Executive Director of Affinity Community Services. Thank you for tuning in today. We have the fourth Friday of the month, and we're happy to be with you. For those of you who don't know, Affinity Community Services is an LGBTQ social justice organization that works on the south side of Chicago. We do work in terms of civic engagement, health and wellness, and leadership development. And before we get started, I want to give a special shout out to all of the folks who are here for the Color of Violence conference that's happening at the Hyatt, McCormick Hyatt today. Actually, it started yesterday and goes through Thursday. It's a wonderful conference that if you're in Chicago, you could go to actually, and it focuses on violence that women and transgender people of color face every day. So shout out to them. And now we're going to get started with a very important topic. We're going to talk about the state budget and what that means for you. So my guest today is Ramon Gardenhire, and Ramon is the Vice President of Public Policy at the AIDS Foundation of Chicago. So Ramon, welcome to the show.
Thank you for having me, Kim.
Why don't you tell us a little bit about the work that you do at AFC and what AFC does?
Great. Well, my pleasure. So the AIDS Foundation of Chicago is marking our 30th year this year. And 30 years, yes, going strong. So we are a HIV advocacy organization. I like to say the AFC actually stands for what we do. The A is advocacy, which is kind of my shop. The F is funding, and then the C is care. And so we, in terms of advocacy, advocate at a national, state, and local level for sound AIDS policy. And so as you talked about, so one of those policies we are very, very, very concerned about this session is the state budget and the impact on HIV services and programs, as well as the Medicaid program.
Now, I know a lot of people have a general sense of what's going on with the state budget in terms of, and we should say this is the proposed budget for the next fiscal year, which actually starts in July for the state. So that's what is being discussed when we talk about the state budget, the current state or the upcoming state budget. $6.6 billion proposed cut?
A $6 billion cut, which is all done through cuts. The governor has proposed no new revenue streams, which means that vital programs and services, everything from child care to hospitals to HIV services and treatment services are on the chopping block.
So I know one of the big cuts is to Medicaid.
Yes.
Right. So can you tell folks what kinds of services fall under Medicaid and what impact this cut might have?
Absolutely. So Medicaid is a program which is a safety net program for the most vulnerable in our state. And fortunately, 2 years ago, Illinois passed Medicaid expansion under the Affordable Care Act, or some people call it Obamacare. And so that allowed individuals who traditionally had not been able to qualify for Medicaid access to Medicaid. So it opened the doors to about 600,000 individuals in the state who now have high quality comprehensive healthcare services. And so the governor's proposal would take us back dramatically in terms of those being people being able to access quality of services. And so some of the proposed cuts, and it's about a $1.5 billion cut to the Medicaid program, which is the largest single cut that any state has ever proposed or looked at enacting ever in the state Medicaid program. So that just kind of gives you kind of the landscaping that we're working with. Some of the Medicaid services that the governor has proposed cutting is cutting adult dental care for individuals who are on the Medicaid program, podiatry, enacting a 4-drug limit. So basically, if anyone who has Medicaid, you would have to get prior approval from the Department of Health Care and Family Services before you can get your 5th drug filled. And so obviously for people who like there are, co-occurring illnesses. So if you're on HIV, you may also have some mental health issues. And so reaching that 4-drug limit would be, you can reach that pretty quickly. Yeah. There's a host of other services that have put on the chopping block, including breast and cervical cancer screenings and treatment in the Medicaid program. The litany of services that he has put on the chopping block is unimaginable.
Isn't it odd that in the state that Obama comes from, Medicaid is being cut so severely after so many advances had been made to get Medicaid expansion. And I know a couple years ago, you and I were talking about the expansion to the dental coverage.
Yes.
Can you explain why that is so important?
The dental coverage is absolutely valuable to individuals being able to have preventative care. I mean, if you think about it, so for instance, if someone cannot get an operation, sometimes if they don't have high quality dental care because surgeons are afraid of reinfections in their mouths. And so, for instance, let's say if someone needs a heart surgery, they won't do the operation until they have fixed the dental issues because it's likely would just lead to reinfections.
Wow.
And I've heard of cases of individuals who have are having issues with being able to swallow, and without these services, they can't get those things resolved. And also, too, it's just in terms of what we have found out when we did cut adult dental back 2 years ago is that it actually ends up costing the state more on the back end because individuals just wait until they have an abscess or, they have some other emergency situation and they show up in emergency rooms, and emergency rooms have to treat them under emergency services versus if they would have had the preventative coverage before they went to the hospital.
That's what really gets me about these kinds of cuts.
Yes.
You might have this big chunk of money that you think you're saving on the front end, but on the back end, you're just gonna see it double or 3 times over when people are coming for emergency care, and then their care is even worse.
Right. It basically, the cheap comes out expensive in these kind of cuts because the pennies that you save in providing preventive care is much more cost effective than what you're going to see on the back end. And you take HIV as a prime example. The lifetime care for medical coverage, and this doesn't include supportive services like housing and things of that nature. Just the medical coverage alone for a lifetime care for new HIV infections is $430,000 on lifetime care.
Wow.
And unfortunately, there's a correlation between poverty and HIV infections, and so many people who are newly infected with HIV would fall under the care of the state.
I'm glad you mentioned HIV prevention because you and I are working on
Yes,
2 fights,
yes.
right? So the first part was for the current budget. There were funds that were appropriated for the African American AIDS Response Fund that somehow money didn't make it to the correct account. And so there are 14 organizations across the state that were told they would receive funding last spring,
Yes.
who have not received funding. And so we're currently fighting to plug that hole. I don't even know if you could really call that a budget hole because that was money that was actually appropriated. And then going forward, again talking about the African American AIDS Response Act, and then we can talk more broadly about HIV prevention and the funding cut. There's a 66% reduction proposed, which would take that fund down to about $500,000 for the state.
Yes. and that's unfortunate, Kim, because unfortunately the HIV/AIDS epidemic is raging within the Black community. We know that 50% of new infections are in the Black community. And so a targeted program like the African American AIDS Response Act, which funds organizations which do work in the Black community, is a dollar wise and, food shortage. Those are directly the organizations who have boots on the ground, connections with individuals in the community to actually do testing and linkage to care. And so cutting these services at a time where we're actually seeing, 50% of new HIV infections in the Black community is taking us in the wrong directions, particularly in terms of not only community health, but good public health policy.
And let's not forget that about 20% of people who have the infection don't even know.
Yes. And that's why it's so important for those kind of organizations which are funded through the African Americans AIDS Response Fund to continue to do the great work that they do in terms of testing people, letting them know what their status is, and then linking them into care. Because what we do know is that when someone is linked into care, they become 96% less likely to transmit the virus to other individuals in the community. So testing and linkage to care also equates to good community care.
That's right. Did we have a caller, I believe?
Yeah, good evening to y'all.
Hi.
What y'all saying is true. It's just like all these politicians. Can you hear me?
We can hear you.
Okay, when they get in front of me, they said one thing, they don't mean what they said about they thought they gonna clear everything out. And then they said they gonna keep everything open. And what y'all saying is true. And the politicians, they go everything is backfired on there. Y'all doing a good job.
Oh,
Thank you.
Thank you so much.
Yeah, but I definitely, thank you, caller, for your comments, and I love your passion. I encourage everyone,
on the bus,
yes,
bro.
to get you on the bus to come down to Springfield, to use that passion and call your legislators to let them know that to stand strong and oppose the proposed cuts by the governor. I think that only by having the winds at their backs, so legislators have the steel backs that they need in order to push back on these draconian cuts that the governor has proposed.
And yes, we can use your passion.
Yeah.
There are a couple of advocacy days coming up, right? You want to
Yes.
talk about that and then some of the training that we're going to be doing?
So AIDS Foundation of Chicago, in partnership with Affinity, we have a couple of events that people can get plugged into. There are two Springfield Advocacy Days. One is April 15th and the other is May 13th. These are completely free. You can go to aidschicago.org and go to the advocacy page and register. It's absolutely free of charge. There will be lunch served, a training, and then you can directly interface with legislators to let them know that these cuts are not acceptable. We also are partnering with Affinity to do a in-depth workshop training on the south side of Chicago to really equip individuals with the skill set they need to kind of really vocalize the strong disgust that individuals have with these proposed cuts. Everything from doing media training to direct advocacy, you name it, we'll be doing that workshop.
And that workshop is going to be on May 2nd. We haven't secured the venue yet, but we will let you know. In fact, if you want to check our website and our Facebook page, you can be kept up to date with that information. Our website is affinity95.org. You can find us on Facebook. We're also on Twitter. And we will be updating you on the location of the training. Also, you should know if you go to our website, there's a place for you to sign up for our newsletter. We send a newsletter out every week, which I find amazing. Thank God for our communications assistant, Treon Alexander. Special shout out to him for getting that newsletter out every week. But that's where we keep folks apprised of what's going on with our organization, but also with other organizations across the region and sometimes nationally. So that's a service we provide to others. We would love to fill up a lot of buses to get to Springfield. I don't think people realize how important it is for them to show up to talk to their legislators. I think a couple of weeks ago when I was in Springfield, there were 2,000 people who showed up, opposed to the holes in the 2015 budget.
Yes. I mean, I think that let's not forget that, this is a democracy. And so legislators respond to individuals articulating what they believe is the right thing to do. And I think that only by having these conversations with legislators to let them know that we're opposed to these cuts, will they know that these are unacceptable and that the community is watching and that we want them to do the right thing. And I think the right thing to do is not balancing the budget on the backs of the working class and most vulnerable in our society.
That's right. Can you talk a little bit about the budget process just so folks understand what that timeline is?
Yeah, absolutely. My pleasure. So the way that the process unfolds is in February, the governor introduces his proposed budget. At that time, the budget is then given to the respective chambers, the House and the Senate. Both chambers then go through a process of looking at the budget, having hearings on them, for various agencies. So everything from, the Department of Public Health, Department of Healthcare and Family Services, the whole litany of, state agencies will come before the appropriations committees and propose their state budgets. Then both chambers will then craft budgets, and then they will then send those budgets to the governor to either sign or to veto. And I do think there's At these committee hearings, there will actually be a budget hearing here in Chicago at the Belanek Building on April 1st, Wednesday at 10:30. It's open to the public. This is an opportunity for individuals in the community to come and let their voices be known before legislators. It'll be before the House Human Services Committee, which has the responsibility of the human service budget in the House Representatives. And so this is a great opportunity for individuals to come and just, hear what the community is saying about these budgets, and also if you have concerns about them, to articulate those concerns to legislators.
We shouldn't be concerned that that's April Fool's Day.
No, we should not be concerned that April Fool's Day.
Okay, I'm just checking.
Yeah.
It just hit me that was
is
the
true.
day.
Yes. Yeah.
Now is that during spring break?
It is during
for the
spring break. It
legislators?
is. So right now, legislators are what they call on their spring break, and so it lasts from this Friday today until April 14th. And this is actually a great time for individuals. If you can't make it to Springfield, call your rep or your state senator. Set up an in-district meeting. They're more than willing to sit down and talk with you, and it's a great opportunity for time for you, if you can't make it to Springfield, to let your voice be known.
Mm-hmm. And that's what they're there for.
Yes.
They're there to talk to you.
Yes.
You put them in office. Even if you didn't vote to put them in office, you still need to hold them accountable, and next time you should vote.
Voting is key. I think, I always like to say, elections have consequences. And unfortunately, we are seeing some of those consequences now in terms of, a $6 billion cut for the most vital services that the state performs.
Yeah. Remember, voter turnout was pretty low in the gubernatorial election, so here we are.
Yeah.
But we can make amends, so show up at your legislator's office. It's a very important thing to do. Make a phone call, send an email, just get in contact with them and let them know what you're thinking and what you're feeling. They do listen, and their offices actually track those calls.
Yes.
They want to know how many people are calling in. Definitely say that you're in their district. They'll probably ask you for your zip code, sometimes your address, just to be sure, because they need to keep track of that stuff.
Yeah, in addition to, if you can't, I know everyone has very busy schedules and many demands on their time, but utilize, the different forms of social media to also engage with your elected official. That's, if you have a Twitter account, tweet them, find them on Facebook and friend them and send them messages, send them emails. They all have email addresses which they do look at. And so I think that any way that you can convey the sense of urgency in pushing back on these budget cuts, I think you should utilize those.
Yes. So it's my opinion that we don't talk enough about HIV and AIDS in the Black community.
Yes.
So can you break it down for folks?
Yes.
What's going on?
It is, as I mentioned before, it is unfortunately an epidemic which is raging within our community, and it's a number of issues which contribute to that. One is, barriers to access to healthcare coverage. One is the stigma, which you've talked about, and people not being, willing to come forth. One is, also just, the social structures of poverty and injustices which are kind of overlaid on top of our community. And so the numbers are staggering. I believe that nearly 80% of new infections in Illinois are between the Black and Latino communities. And so I think that it's time for us to step up, get tested, and get linked to care for those of us who do turn out to be HIV positive. So I think that it's critical that we start having these conversations in our community. And you alluded to earlier, the estimates are 15 to 20% of the HIV people who are currently HIV positive don't know their status. And so that's also in terms of their own personal health consequences for that, but also for community health as well too, because again, if once someone's tested and then linked into care, the likelihood of them transmitting the virus to someone else in the community is reduced by up to 96%.
That is staggering.
Yeah.
That is just staggering. And lots of young people.
Yes.
The rates are really growing fast.
Yeah.
In the age group.
Yeah, young people between the ages of 13 to 29 make up 40% of those new HIV infections as well too.
And we talk a lot about men having HIV
Yes.
and AIDS. Women do too.
Yes, yes. Women and seniors, and
Seniors.
HIV does not discriminate. Every demographic is impacted by this disease. So I think that it's important that everybody in our community again kind of know their status. It's important from the very young who are sexually engaged to our seniors who are sexually engaged.
And they are.
Yes,
Don't-
they are.
Don't say they aren't.
They are. Yes.
I think we have another caller. Hello?
Hello.
Hi.
Hi. So I was listening to your conversation, and I think it's super timely given the announcement we received about Indiana and the HIV/AIDS crisis. I was wondering, perhaps if you could, sort of give us some information, since that's, just 20, 30 minutes over from us, about some things we could do to be safe and kind of what happens during a public health crisis.
Yeah, I mean, I applaud the Indiana government now in kind of adopting a temporary syringe exchange program. I think that syringe exchange programs have been universally effective in helping stopping transmission of HIV, and so I think that that's one of the recommendations I would urge Indiana to adopt is to make their syringe exchange program permanent. We know here in Illinois that once that was done, is that you dramatically reduce the number of HIV infections and those who are using intravenous drug uses, and so I think that's one way to help stem new HIV infections.
I thought the caller was going to talk about the new law in Indiana that the governor signed.
That's
that really took several steps back toward Jim Crow days for LGBT people.
Yes.
When it comes to public accommodations, it's allowable for businesses to discriminate.
It's unfortunate that Indiana has decided to kind of be an outlier and not accept quality as a just burgeoning number of new states have decided to actually embrace equality, everything from marriage equality to non-discrimination laws which are passing in the workplace, and Indiana definitely is going backwards, unfortunately.
The wrong way.
Yeah.
We have another caller, I believe.
Yeah, how you all doing this evening?
Good.
Thanks for taking my call. My question is, I know the emphasis today is prevention of HIV and AIDS. Why aren't we ever talking about where did this come from? I'm very old school. I'm a black gay male, and I lost a lot of friends in the 80s when this epidemic started. And like I said, I understand that this is about prevention. I mean, it's here now. But I don't ever hear we have stopped talking about where did this come from. And I'm just curious, why are minorities so disproportionate? Why is it so high among us? I don't think we're having different kinds of, or more sex than anybody else. I'm just curious, why has it got us like this?
Thank you for your question. We're going to answer it while you're off there, okay?
Yeah, I think one of the issues why the HIV infection tends to be so high in communities of color is people of color, like most people, tend to engage in sexual activity with people who look and have shared experiences like them and reside in their areas. And so, as we talked about before, unfortunately, the prevalence rate or the viral load within communities of color tends to be higher, and that's kind of a byproduct of many of the things that we talked about in terms of lack access to healthcare coverage, and some of the kind of the social isms, racism, and poverty, and those things as well. So I think that's why the number tends to be so high in communities of color. I do want to say that, again, I think that ensuring that we adequately fund HIV services to make sure that people who don't know their status get tested and linked into care is one way to bring down the virus in communities of color.
Yes, and I think there's still a lot of controversy over the origins of HIV and AIDS, so we don't have time to deal with that here. In fact, we are out of time, unbelievably. This was a great conversation, Ramon. Thank you so much. Again, I encourage you to go to our website, affinity95.org, or our social media, where you will find information on these upcoming trainings and advocacy days and all the work that Affinity does, and also sign up for our newsletter. So I know it's spring, there's snow on the ground and all that, but it will get warmer, so hang in there. And when we see you next month, I hope the sun is shining. So thank you and have a great weekend.